Assalamu alaikum and good evening. I'm Dr. Farooq Rathore, Rehabilitation Medicine Consultant and Pain Physician based at AFIM Rawalpindi. And today I'm going to describe rehabilitation perspective in Parkinson disease. Before we move on to the rehabilitation perspective, it is important to understand that what are the factors that contribute to the overall disability in Parkinson disease. In no particular order, they may include reduced manual dexterity. We know that tremors are mostly the most common symptom of early onset of Parkinson disease, and a patient with Parkinson disease will actually lose their ability to use their hands, resulting in micrographia and inability to hold things and do all the things with the hand that they were used to do before the onset of Parkinson disease. A patient of Parkinson disease has mobility dysfunction. It could be a combination of weakness, bradykinesia, and other factors. And patients of Parkinson disease, because of lack of balance, are at high risk of falls. A patient with Parkinson would also report more fatigue as compared to the patient without having such symptoms. And this ultimately results in difficulty in performing the activities of daily living, or what we call ADLs. ADLs are the thing that we take for granted, and they are the basic things that a human being needs in order to perform the daily activities. They could include simple things like bathing, combing, dressing, going to the toilet, and mobility and communication. But in a case of Parkinson disease, because of the factor that I just described, they would be compromised. In addition, a patient with PD would also have speech impairment, and once you have a speech impairment and lack of communication, that can actually lead to isolation because people cannot understand what you want to say. And many patients with PD would actually develop dysphagia, which would compromise their nutrition, ultimately negatively affecting their health. This all leads to a person with Parkinson disease who might be having a good medical management but would be confined to his or her home and would not be able to participate in active daily living. The mobility would be compromised and he would not be an active part of the general society. So what is the answer? Apart from the medical management, which is the cornerstone of management in a case of Parkinson disease, it is also important to offer these patients a multidisciplinary rehabilitation team management. The important member of a rehabilitation team includes a rehabilitation medicine physician or a physiatrist as a team leader, physical therapist, occupational therapist, a speech therapist, and a clinical psychologist. And the center of this team is the patient and family who actually give the direction to the treatment. I'm going to describe the role of each of these members in detail later on. Before we move on, we need to understand that what is the benefit of offering rehabilitation services to the patient with Parkinson disease. A lot of research has been done in the last 40 years, and it has shown that early rehabilitation intervention, when offered in a multidisciplinary team approach, are very beneficial for a patient with Parkinson disease. So motor symptoms are one of the most common symptoms with the patient would present to you. Maybe tremor and rigidity, and these symptoms can negatively affect a patient's ability to perform the ADLs. Offering them an early coordinated rehabilitation would in form of maybe exercises or maybe physical therapy, the balancing exercises would mean that the patient is going to perform better as compared to someone who is not being offered a multidisciplinary comprehensive rehabilitation. The second thing is that the patient with Parkinson disease are at high risk of fall because of balance dysfunction and because of weakness. So if you offer them a coordinated balancing program, and again the details I'm going to share with you later on, and if you offer them like Frankel coordination exercises, or maybe if you have a Biodex balancing board available at your institute, and so many other things that can improve the balancing a gait of the patient, resulting in improved physical function. And it would also reduce the risk of fall. Risk of fall is one of the major concern in a case with Parkinson disease, because a risk of fall can lead to increased risk of fractures, which can further compromise the mobility and also increase the mortality and morbidity of a patient with Parkinson disease. Research has also shown that overall rehabilitation perspective would lead to a delay in the progression of Parkinson disease. Now, the exercise is not going to reverse the process, or it's not going to cure the patient of the disease itself, but it is definitely going to delay the progression of symptoms and ultimately resulting in an improved quality of life, a reduced disability, and a better community reintegration. There are certain considerations whenever you want to offer rehabilitation in a case of Parkinson disease. The first and probably the most important is earlier is better. And here I would like to request to my colleagues in neurology, the neurologist and the resident in neurology and maybe the medical specialist as well, that whenever you make a diagnosis of Parkinson disease in a case, please do not wait till the time disability takes over and the patient is either wheelchair bound or bed bound and the disability has progressed to a level where probably simple rehabilitation intervention will not matter to the patient. So please, whenever you make a diagnosis of Parkinson disease or any movement disorder, do refer that patient for a comprehensive assessment and rehabilitation to the nearest rehabilitation medicine physician or department. We also need to understand that rehabilitation intervention are not only going to help with the motor symptom, bradykinesia, weakness, risk of fall, fatigue and weakness and stuff like that. They're also going to help with the non-motor symptom. Many patients with Parkinson would present with cognitive dysfunction. Some have communication deficit. Others are having problem with swallowing and dysphagia. And there are some who would present with pain. So rehabilitation can address not only the motor symptom but can also help with the non-motor symptoms. Another important aspect that often gets neglected, at least in developing countries like Pakistan, is that for most of the people, including the patient themselves, healthcare professionals, and even neurologists, they think that rehabilitation in Parkinson disease is all about exercises and physiotherapy. Now, we need to understand that physical therapy or physiotherapy is an integral part of the whole paradigm of a multidisciplinary team approach in Parkinson disease. But then you need to understand that physical therapy or physiotherapy is only part of the equation. We are talking of a multidisciplinary team approach in which multiple rehabilitation professionals sit down together and depending on the condition and disability level of the patient and the goals that you want to achieve, they come with a common solution. So please, wherever possible, go for a multidisciplinary team approach instead of relying only on exercises and physical therapy. And it is very important to understand both from the perspective of healthcare professional and also to guide and counsel the patient that these rehabilitation interventions are going to enhance your quality of life, reduce your disability, improve your mobility, but they are in no way going to reverse back the disease process. Parkinson disease as present is actually an incurable disease. So yes, we can help you with medication, we can help you with different kind of rehab interventions, but these interventions are only going to maybe retard the progression of the disease, but they are not going to reverse the disease process itself. It is very important to have these kind of conversation with the patient and the attendant and the caregivers and family members right at the start when you start doing rehabilitation interventions so that there are no confusions and the patient and the attendants are very clear about the goals that they want to achieve at the end of the rehabilitation cycle. There could be different kind of rehabilitation interventions that you can perform in case of Parkinson disease. So I have just for the clarification, I have divided them into the traditional one and then the recent advances. So the traditional one would include number one, disability assessment and evaluation and a goal setting. Because from a medical point of view, maybe whether the patient is having any background, he comes from a rural area or he comes from a city, he's employed as a teacher or he's a soldier or maybe he's a banker, the medical management would almost remain the same. But this is not the case with rehabilitation and disability assessment. Why? Because disability depends on multiple factors, both intrinsic and extrinsic factor. And we actually determine the disability of a patient, whether it's case of a stroke, spinal cord injury, amputation, cerebral palsy, backache, or even Parkinson disease by using the ICF model proposed by World Health Organization. So the ICF model is International Classification of Functioning, Health and Disability. Will not go in detail, but this has to be actually done at the start of the rehab process. Then physical therapy is basically all about exercises, balance training, coordination, and it could be performed manually. It can be performed by using different kind of machines. There are different kind of exercises like Frankel coordination exercises, different kind of stretching exercises, strengthening exercises that can again be done manually or by the use of machine. And then there are different tools available, for example, Biodex balancing board, the rocker board, the wobble board, and so many things that our colleagues in physical therapy employ in order to improve the fatigue levels, in order to improve the balance, coordination, and strength in the case of Parkinson disease. Occupational therapy is a very important part of the whole paradigm of rehabilitation of Parkinson disease. Unfortunately, because occupational therapy is not commonly available in Pakistan, so even healthcare professionals are not very clear that what is the role of an occupational therapist. So the first thing you need to understand is that occupational therapy is independent from physical therapy. That's the first thing you need to understand. It's a totally separate kind of teaching and training program, resulting in a bachelor degree program. Then basically the physical therapist, the occupational therapist, they focus on helping a person perform the activities of daily living, the things that matter to a human being the most. For example, like grooming, cooking, dressing, and they will employ different kind of techniques, maybe for example, home modification, environmental modification, then how to reduce the fatigue, energy conservation techniques, and also the hand dexterity and upper limb dysfunction is classically managed by an occupational therapist. So this is the role of an occupational therapist in a multidisciplinary team approach. Speech therapists, or what we call a speech and language pathologists, are very important and integral part of a rehabilitation team, because many patients with Parkinson disease are not only going to develop communication disorder, their voice is going to become dysarthric, they will not be clear, and they will not be able to communicate with the wider world out there. In addition, many of them would develop dysphagia, leading to difficulty in swallowing and also leading to nutritional deficiencies, which ultimately negatively affects the outcome and rehabilitation of case of Parkinson disease. So a speech therapist is going to focus on the assessment, evaluation, and the exercise plan, both for speech disorders and dysphagia. So they are a very important member of the traditional rehabilitation team. Many patients with Parkinson disease, at least in the long term, they would have some kind of cognitive dysfunction, which would negatively impact their ability to perform a daily task. So a cognitive rehabilitation may include exercises that target specific cognitive skills, like memory training, problem solving, and then this rehabilitation, cognitive rehabilitation, can help a person with Parkinson disease improve their memory and concentration skills, which would mean that the patient would be able to perform their daily activities and interact with the community at a better scale. Now coming to a few advances in rehabilitation of Parkinson disease. Uh, I would not say that these advances are very new. Some of them are already being used for the last 10 years, but they are not commonly used in a developing country like Pakistan. The one that I'm going to show, they are not wholly solely based on technology. They are very low cost and they can easily be integrated in your rehabilitation paradigm or rehabilitation services that you offer to the patient. So I'm sharing these advances only as a food for thought. So gait training is one of the major concerns for which the patient would visit a rehabilitation medicine consultant. And there are a lot of protocol available for gait training. Again, what we call the traditional gait training protocols. So there's something very simple which is known as pole striding, or what we call Nordic walking. So you might have seen कि जब आप बर्फ में चलते हो तो आप दो पोल इस्तेमाल करते हो, right and left. So basically you walk on the ground like this and you use two poles, and a rhythmic oscillatory movement आप करते हो right and left in a manner that actually helps improve your gait pattern. And this has been performed in Parkinson disease patient and patient with other neurological disabilities, and the result have been very good so far. So for example, the study that I showed, so इसके highlights ये थे कि gait impairment in Parkinson severely affect the quality of life, and the traditional treatment that we usually offer to our patient, they do not fully address the problem of gait and balance in cases of Parkinson disease. And the major risk factors are gait variability. The patient might have a long step, a short step, fascination, and stuff like that. And they would actually lead to falling and ultimately increase mobility for the patient. So pole striding would improve gait rhythmicity and step and the stride amplitude. And there's a recommendation that regular pole striding may reduce the risk of fall in Parkinson disease. So because these things are very simple, they are not technology dependent, they have no side effect whatsoever. So probably it's a good idea to explore these kind of simple things in your rehabilitation practice as well. Again, another randomized controlled trial that was done on pole striding or Nordic walking, and the conclusion was that a mild to moderate intensity Nordic walking or pole striding session, which means minimum of 12 session or 60 minutes each, they could range from 6 weeks, 1.5 mahina, to 24 weeks, that is 4 months. It resulted in positive effects on severity, gait, balance, and quality of life, functional capacity, and motor function in patients with Parkinson's disease. So food for thought to integrate pole striding or Nordic walking in rehabilitation perspective. Tai Chi is a traditional Chinese exercise which is very famous and very popular all around the globe. It is being done by healthy people, people in geriatric age group, and people with neurological and orthopedic disability. It can be done by a person from any age group. Kids can do Tai Chi, adults can do Tai Chi, and even elderly in their 80s and 90s can do Tai Chi. Tai Chi can be done in a group setting. Tai Chi can be performed independently all alone. Tai Chi can be done while you are standing. Tai Chi can be done while you are sitting. So there are so many options and variations available for Tai Chi, which is a traditional Chinese exercise. And again, a lot of research has been done. I'll just quickly show a couple of those. And they all show that Tai Chi has a role to play in improving balance and coordination and mobility for patients with mild to moderate degree of Parkinson's disease. So please do give it a try. Most of you might be very familiar with the traditional exercise bicycle. अक्सर घरों में मौजूद होती है, the stationary bicycle. But in Parkinson's disease, we talk about the recumbent cycle training. So basically, as we described, that one of the major issues with the case of Parkinson's disease is that they have poor balance. So many of them are unable to maintain themselves or do the traditional bicycling session. So in those cases, this recumbent cycle, which is safer, which offers more safety, and which is easy to perform for a case of Parkinson's disease and other neurological disabilities, is the answer. So research has shown, again, a randomized control trial was carried out, and the conclusion was that almost all the outcome parameter of Parkinson's disease showed a significant improvement when the patient were put on recumbent bicycle technique thrice a week for 4 weeks. So again, it is available in Pakistan. It is something that can be integrated, something that has no side effects, and something that has a very positive effect for patient with Parkinson's disease. So please do try this one. Exergaming, again, very common, and the two options that we commonly know and हमेशा अक्सर घर में मौजूद हैं are Nintendo Wii and Xbox Kinect. So basically, the avatar on the screen is actually a reflection, or whatever the person standing in front of the screen is doing, the avatar moves accordingly. And there are many games available which help in improving the balance and coordination and upper limb dysfunction in patients not only with Parkinson's disease but other neurological disabilities as well. Lot of research has been done, lot of articles and randomized control trial and systematic reviews are now available on this topic. And sort of summary of this research is that exergaming, both the Wii and the Xbox Kinect, they're emerging tool to help rehabilitate motor skills in people with Parkinson's disease, because they provide a different kind of enriched and stimulating environment. The major problem with Parkinson's disease and other neurological disabilities is that patients get bored in doing the same thing again and again in a very familiar environment. So this kind of exergaming provides them with a different kind of stimulating environment that is more exciting and it is more appealing for them. It is safe, it is feasible. Probably a second hand would cost you somewhere between 25 to 45,000 rupees, which is actually less than the cost for 2 month physical therapy for a patient. And the result or the summary of different trials published in the last 15 years on this topic show that the balance-based exergaming training resulted in a greater improvement in postural stability compared with the conventional balance training, which ultimately leads to improved body function and quality of life. Moving on, because of lack of time, I'm not going to go in detail, but there are certain other emerging options available. Variable technologies and sensors, these are very important. These are basically, you can say, sensors which detect the body movement or a patient or Parkinson's disease. They provide real-time data. This data can be used to modify the medical treatment and also the rehabilitation program, the gait training program, and it also provides real-time medical data about the patient as well. Then non-invasive brain stimulation, the transcranial magnetic stimulation. My colleague is probably going to talk about it in detail, so I'm going to skip this one. Then LSVT, the Lee Silverman Voice Treatment Program. It's a unique and different kind of program which was actually started back in 1980s for a lady known as Mrs. Lee Silverman. It is now being used in different parts of the world. To the best of my knowledge, I can be wrong, so apologies for that, but probably in Karachi there's only one place Ziauddin Medical University, where LSVT program is available. There are many variations of LSVT. The LSVT loud is primarily based for speech and communication. The LSVT big is basically for motor retraining and function. And now LSVT is also available as an application form in which the patient can engage while they're at home. And there is emerging role of tele-rehabilitation, because we know in the wake of COVID-19 the services were closed, and this tele-rehabilitation has a lot of sort of potential in order to provide rehabilitation services in Parkinson disease to patients who don't have access and who are not based in major cities. The last is that there are certain challenges in rehabilitation for Parkinson disease that we need to understand. The first is unfortunately a lack of awareness about the role of rehabilitation. The eye cannot see what the mind doesn't know. The general public and even healthcare professionals are not aware about the positive role that rehabilitation can play for a patient with Parkinson disease. Unfortunately, if they know about rehabilitation, there's limited access to rehabilitation services. And this is not something that is very unique to Pakistan. Research was done in the USA, which definitely has a much more advanced and better healthcare system than Pakistan. And even there, they found that rehabilitation therapy utilization among older adults with Parkinson's disease was low. Then the other challenge is that we don't have enough rehabilitation medicine consultant in Pakistan. Most of there are not enough speech therapists, there are not enough occupational therapists, and most of the patients with Parkinson's disease are only going to do the physical therapy. Then unfortunately, the lack of multidisciplinary collaboration. I just mentioned that most of the rehab plan that we offer in Pakistan is based on physical therapy and not an MDT approach. And then adherence to rehabilitation program is also a major challenge. It could be because of lack of motivation, because of fatigue, because of repeated falls, and definitely because of finances as well, because sometimes rehabilitation costs a lot of money. So the summary of this presentation is that neurorehabilitation interventions have shown to improve the motor function, reduce the risk of fall, improve the quality of life, and delay the progression of Parkinson's disease. But there are several challenges that need to be addressed before we can offer a good multidisciplinary team approach to a patient with Parkinson's disease. Early rehabilitation can make a positive difference, and that's why a multidisciplinary team approach consisting of a rehabilitation medicine physician, occupational therapist, speech therapist, clinical psychologist, and physical therapist is preferred over a single person perspective. The take-home message is that you should all be advocates for comprehensive Parkinson's disease management. And please, that's why whenever you see and diagnose a case of Parkinson's disease, please refer him or her early to a rehabilitation medicine physician so that disability can be assessed and an appropriate rehabilitation plan can be made. Patient education and support for rehabilitation is mandatory. Again, the eye cannot see what the mind doesn't know. Patients usually do not know the value of rehabilitation, and you have to educate them. And please think beyond exercises and physiotherapy alone and try to integrate all aspects of a multidisciplinary rehabilitation for the optimal management of a case with Parkinson's disease. And hopefully, if you collaborate with other rehabilitation professionals and offer an MDT rehabilitation, you are going to help that patient with Parkinson's disease who is probably getting a very good medical management but still is confined to his or her own home because of increased risk of fall, fatigue, cognitive dysfunction, and lack of mobility. I thank you all. If you need a copy of the presentation, please feel free to email me at this address. And again, I thank you, Dr. Abdul Malik, for inviting me to this webinar. Assalamu alaikum. Thank you very much.